Good afternoon and welcome to this press conference. Since we moved to the current preparatory stage, the local Covid-19 cases have increased significantly with 216 locally transmitted cases reported today. Although we had anticipated an increase in local cases with the resumption of activities, we need to continue to monitor the situation to avoid a significant and sustained surge in cases that may overwhelm our healthcare system. On vaccination, we have made further progress. As of 2nd September, more than 80% of our population has received 2 doses of the vaccine, and close to 85% have received 1 dose. However, we would like to continue encouraging those who have yet to be vaccinated to come forward and to do so. We will continue to take a cautious, calibrated approach to reopening, and we will stay at this preparatory stage and maintain our current safe management measures for a while more to allow us to monitor the situation and ensure that it remains under control before opening further. As we resume more social and economic activities, we can expect transmission to increase. Therefore, we will also need to step up our testing to help us pick up cases earlier and faster to slow down the transmission. Vaccination and testing will therefore be our twin engines as we journey towards COVID resilience. The Ministry of Health had earlier announced that they will be distributing ART self-test kits to all residential households. This is part of our move to encourage everyone to carry out self-tests to protect you and your loved ones, and as part of social responsibility. Employers, too, should also consider testing your employees regularly, even if the government has not mandated it. This is also part of a business continuity strategy. To supplement regular self-testing, we will also allow members of the public to make an appointment for a self-paid fast and easy test at any one of the quick test centers from 1st October. By making testing a way of life, we will be able to detect cases early and minimize the risk of transmission. On vaccination, the Ministry of Health has been studying the issue of booster shots. Let me give a quick update. MOH and the Expert Committee on COVID-19 vaccination have evaluated the need for booster shots. They have concluded that it will boost vaccine effectiveness and maintain a high level of protection against more severe infections. For a start, MOH and EC19V have recommended booster shots for those who are immunocompromised and seniors aged 60 and above. Minister Wong will elaborate on this later. Let me once again thank everyone for giving us your trust and support. This has allowed us to make significant progress in our vaccination program. Let us continue to work together in this journey towards a COVID-resilient state. Thank you very much. Let me now call upon Director of Medical Services, Professor Kenneth Mak, to give an update.
Thank you very much, Minister. Minister's given a very quick update also on the overall local situation in Singapore. We all are aware of the increase in number of cases. COVID-19 cases have been detected and reported recently. Yesterday, the Ministry of Health reported 187 cases of locally transmitted COVID-19 infection. Today, that number is 216 locally transmitted cases out of a total of 219 cases that we're reporting. And based on the confirmed cases as of the 2nd of September, there were 528 patients admitted in our acute care hospitals, of which 5 patients were in the ICU. And all these ICU patients were either unvaccinated or only partially vaccinated. An additional 27 patients in our general wards required oxygen supplementation. The majority of them, about 80% of them, were cared for in our public hospitals, while the remaining 20% of cases were admitted in our private hospitals. And we have seen 885 cases yesterday cared for in our community care facilities. The increasing number of cases will naturally raise concerns among members of the public who are concerned that the COVID-19 situation may be deteriorating. The rise in the number of COVID-19 cases in the community is not unexpected. We have moved away from the restrictions imposed under Phase 2 heightened alert, and there are more people leaving their homes now on a daily basis for work or for social activities. Groups of up to 5 people may now gather for meals and social gatherings. So the opportunity for close, mask-off physical interactions has now increased. Phase 2 heightened alert was not imposed with the intention to simply suppress COVID-19 infection to the extent that we would eradicate all such infection in the community. The measures introduced reduced close contact encounters sufficiently to ensure that the number of new cases that emerged were sufficiently suppressed so that the demand for hospital isolation beds and ICU beds could well be met by the available resources that we had in our healthcare system, while allowing our vaccination campaign to proceed so as to achieve a high enough vaccination coverage in our population. And these measures have been successful so that our healthcare system was not overly burdened, and we have previously announced that, that we've achieved a very high vaccination coverage rate. As of the 2nd of September, 80% of our total vaccination resident population has received the full 2 doses. And this means that, that we have greater confidence now with such a high vaccination rate that we can move on in our transition eventually towards an endemic phase. Being fully vaccinated doesn't mean that those who are vaccinated would never get infected with COVID-19. But what it means is that vaccination reduces your risk of getting infected if exposed, and it reduces your risk of getting a severe COVID-19 infection. Vaccination means that your chances of needing ICU care or even dying is greatly reduced. And indeed, over the last 28 days, the percentage of those who are unvaccinated and who became severely ill or died was 9.2%, while those who were fully vaccinated but then became ill was 1.3%. And this is a 7-fold reduction in severely infected or death rates, a stark difference which actually demonstrates the protective benefits that vaccination provides. So even though the number of community cases has increased, there has not been a significant surge in the number of cases which requires intensive care. Our ICU admissions have held relatively steady. Last week, we had about 6 to 7 ICU cases. This week, in the past few days, we've had 5 cases in the ICU and no new admissions in the ICU since the 21st of August. So even though the total number of local cases has increased from an average of 58 cases a day in the week before to 132 cases per day in the past week, that ICU numbers have not increased correspondingly. The clusters of cases in the Bugis Mall and the bus interchanges have involved individuals who are relatively young or did not have risk factors for worse outcome. Many of these individuals were also vaccinated, and so they too derived the protective benefit of being vaccinated. Over 98% of individuals who were infected were either well, without any symptoms, or mildly symptomatic, with at most minor respiratory symptoms. And we expect them to recover without much need for further medical care. Nonetheless, we monitor them very closely to make sure we provide them with the appropriate treatment for their clinical needs. Many of these infected individuals may either be directly admitted into our community care facilities or CCFs, or transferred early during their recovery to the CCFs from the acute hospital after an initial period of observation. We've just commenced our home recovery pilot and continue to identify suitable patients who are well and who have home settings which are suitable to allow them to safely recover at home without the risk of infecting their family or neighbors in the community. And in time, this will be an important option which allows well but infected individuals to recover in the comfort of their homes in time to come. Notwithstanding the low numbers of sick individuals presently in our hospitals, we must be prepared for any possible surge in the number of cases as we open up to more community activities. Of specific concern is still the cluster of cases at the bus interchanges. The epidemiological investigations so far have not identified specific modes of transmission, but it's highly likely that spread has occurred within the work environment, possibly due to mask-off interactions during rest periods at the bus interchanges. The preliminary phylogenetic test results do support that this is likely a workplace transmission event. How infection had first been introduced into the bus interchanges is not clear. But given the higher number of cases in the community presently, it is not unreasonable to expect that introduction of infection had occurred from the community. Perhaps some bus captains had gotten infected in the community, and they in turn infected other bus captains in the interchange. We've also seen some infected bus captains bringing infection back into their households and infecting their own household members. We have no evidence as yet of any passengers or users of public transport being exposed and infected. So the clusters still appear to be confined to the workplace at the bus interchanges. And the measures announced yesterday by the LTA will prevent potential further spread of infection at the workplace, which helps us to better manage the clusters. We are mindful of the need to be targeted and focused in our public health actions so as not to unduly compromise essential transport services while seeking to disrupt further transmission at the interchanges. And we will continue to work closely with the LTA and the bus companies for bus captains to be tested regularly using ART test kits, which will supplement the testing operations that we had already conducted in some of the bus interchanges. We have tested more than 7,000 of the staff at the interchanges as part of our active surveillance. We have found more cases, with about 2% of those tested being positive for COVID-19 infection. It will take the rest of this week for the situation to stabilize, and we anticipate that the number of cases from the interchanges may start coming down in the following week. While we remain optimistic about being able to bring the cases down, we're not still talking about cases coming down to zero. But if the numbers continue to come down to a level which does not present many more people becoming severely ill and requiring ICU care, the healthcare system will remain resilient and be better able to handle the ongoing challenge of controlling and managing COVID-19 while supporting the healthcare needs of our population. Thank you.
Good afternoon. We are continuing to monitor the situation closely, and as you heard from DMS just now, the increase in cases that we are seeing recently is not unexpected because they arise from the resumption of activities that have taken place over the recent weeks. And as we have said before, we are shifting our approach. Our main focus is not just the daily case numbers, because many of them are vaccinated persons who become infected and they have mild or even no symptoms. Instead, our focus is on the smaller number of infected persons who need supplementary oxygen or ICU care. And this figure remains stable and under control. In the past, when we have a situation of such high daily cases, we would have looked to measures like a heightened alert or even a circuit breaker to control the infection. But we are in a new phase where we have a high level of vaccine coverage to protect Singaporeans, and we are now moving into a phase of living with COVID and becoming COVID resilient. And so we assess that there is no need to impose tightened restrictions. In fact, we would only revert to such a tightened posture as a last resort to prevent our hospital system from being overwhelmed. At the same time, we do not intend to make any new opening moves at this juncture because there is a time lag between the onset of infections to serious illness. And so we want to take some time to monitor the situation. Also, we have recently announced a whole series of pilots, be it vaccinated travel or allowing our workers in the dormitories to be out in the community. So we want to allow these pilots to continue over the next few days and weeks before we contemplate further moves. Meanwhile, we will continue with aggressive testing and contact tracing. So even as cases rise, through testing and tracing, we will be able to slow down the transmission and avoid uncontrollable surges in cases that can easily overwhelm our hospital system. In particular, we believe that there is scope to do more on the testing front. So we will redouble our efforts to make regular testing part of the new normal. For certain high-risk settings, the government has already mandated rostered routine testing. So that's already done for people working in these high-risk settings. But regular testing should not be confined to persons working in such higher-risk settings. In fact, we want to strongly encourage everyone, whether you are vaccinated or not, to self-test regularly with antigen rapid test kits as a matter of social responsibility. And that's why the government decided to distribute these antigen test kits to every household. And some of you have already received it, and eventually everyone should get a pack of 6 kits. Beyond the ones that the government has distributed, you can also purchase these test kits. They are widely available at major retailers and e-commerce platforms. We are also actively reviewing new kits for sale and will continue to make such self-test kits more readily accessible. So we want to encourage everyone to consider testing regularly, especially, for example, if you are going to participate in a high-risk activity or attend a large-scale event and you want to ensure that you are free from any virus, test yourself on a regular basis. To supplement regular self-testing, members of the public can now make an appointment for a test at the 20 quick test centers that we have set up across the island. Right? These centers were set up previously to support businesses and workers who needed supervised self-swab as part of the mandated requirements. But we will open it up for members of the public if they wish to take a test. And we are studying the setting up of more such testing sites across the island so that it will be easier for people to get themselves tested regularly. Employers can play a role too. We would encourage employers to see how they can make regular testing at workplaces a new norm. And so the tripartite partners will be discussing further guidelines to promote more pervasive use of antigen rapid tests at workplaces. This will, again, as I said, go beyond the routine tests or the vaccinate or regular test regime which we are implementing. Right? This is moving beyond all of these mandated testing requirements towards making testing a new norm and making testing more pervasive. We have already reached very high levels of vaccination. We are one of the foremost countries in terms of vaccination. We should now aspire to be a nation of testing, where testing becomes a way of life. Finally, let me just say a few words on safe management measures, because that's another effective way for all of us to do our part to slow down transmission rates. We have these safe management measures in place for some time. Everyone knows what they are. Beyond mask wearing, safe distancing, these are basic measures which can be very helpful in slowing down transmission. Our enforcement officers continue to be on the ground. They are inspecting different establishments, and they will enforce the rules fairly and firmly. For example, if there are minor offenses, they may issue a warning, they may issue a fine. But if there is a major breach, for example, multiple breaches of the 1 meter rule in any particular establishment, or they inspect, or there are attempts to even block the enforcement officer from doing their jobs, then such a major offense will result in immediate closure of the establishment. These rules are in place today, and our enforcement officers, as well as the safe distancing ambassadors, will continue to be on the ground doing these checks. But we cannot rely only on enforcement. All of us must also do our part as part of our social responsibility to comply with the measures and try our best to prevent large clusters from breaking out. So with regular testing, with effective safe management measures, we can keep things under control and continue on this journey of reopening safely. Thank you.
Thank you, everyone. I will speak mainly on the booster program, but let me just say something about our local situation. Well, just looking at the interchange numbers, actually the number of cases in the interchange is coming down. Say Boon Lay bus interchange, for example, at its peak, which is 4 days ago, 30th of August, it has 21 cases through our swab ops, through people not feeling well coming forward and get tested. Today is 5, so it has dropped 21 to 5. Toa Payoh as well, 4 days ago at its peak, 20 cases. Today is 3. Tampines was 6 days ago, or 5 days ago, 29th August, 8 cases. Today is 1. So you see that pattern happening throughout the bus interchanges. So the cases in the bus interchanges is actually coming down. But our overall figure is going up, mainly contributed by unlinked cases, so they caught it somewhere, as well as cases still pending classification. But these are not cases where through swab ops at the interchange we discover them. And these are cases that is reported and then we are trying to link them. I think it reflects the fact that our contact tracing, isolation testing at the bus station is working, at the bus interchanges is working, is suppressing the infections. But at the same time, as ministers have said and DMS have said before me, as we circulate more, as we open up, we are seeing more sporadic cases all over the island. So I thought, give this context so that we understand the numbers when we are reporting, because I'm mindful that when people see a high number, today 216, they think it's all bus interchange. Actually, it's not. Bus interchange numbers are falling. I want to just add one more point to what DMS said just now about our home recovery scheme, the pilot scheme. In the coming week, we expect maybe about 50 cases where we can let them recover from home. And the objective is really to get our operations smooth and all sorted out, and before we expand the program. We really need this in order to be able to live with COVID. As mentioned before, in many countries like the US, Japan, UK, in many European countries, they are already doing this. So there's a lot of international precedents and they can carry it out safely. So if you find that you have a neighbor infected and recovering from home, you cannot meet him because he will be isolated in his room. Yeah? But please give him your full understanding and full moral support. Let me now talk about vaccination. As DMS have mentioned, we are making good progress. Latest data, 81% of our population completed full regimen. 84, and in fact over 84 have received 1 dose. That means at some point, probably within this month, we will have maybe about 85% of our population having received 2 doses, which is really quite a high rate. More importantly is the booster program now. The Delta variant is a lot more infectious, as we know, and is transmitting all over the world. It has become the dominant variant in many places. There are a few clear observations from international data as well as our own data. First, there has been more breakthrough infections where fully vaccinated individuals are infected with the Delta variant. Vaccines still protect a person against infection, but the strength of the protection will come down as antibodies wane several months after the vaccination. In Singapore, our data shows that the ability of vaccination to prevent any COVID infection is around 40%. Second observation is, despite this, vaccines continue to be very effective in protecting against severe illnesses and deaths should you be infected. In fact, we report these numbers every day. So For the past 28 days, as mentioned by DMS, percentage of vaccinated people infected with COVID-19 who get very sick or die is 1.3% compared to 9.2% for unvaccinated people. So 7 times less, sometimes it's more. This is because even when the antibodies wane, there are memory cells in our body that has learned how to produce new antibodies the next time they meet the COVID-19 virus. They recognize it and they produce new antibodies. So your antibodies wane doesn't mean that you cannot protect yourself against severe illness. You have memory cells who have learned how to do this. So it's a little bit like going to school. I asked my doctor colleagues whether I can use this analogy, and they say it's appropriate. So it's a bit like going to school. When you prepare for exam, you cram a lot of facts in your brain, and then after you take the exam, shortly after that, you forget all the facts. But you are still left with a very valuable education, skills, knowledge that you can use for the rest of your life. So producing antibodies is a bit like preparing for exams. Cellular response through memory cell is like your underlying education. Yeah, it's still very valuable. Notwithstanding this, recognizing waning immunity and increasing breakthrough infections, a few countries have decided to start vaccine booster program. And this is to preempt a very sharp rise in breakthrough infections, which can still mean, in absolute terms, many people can fall very sick or die. Yeah, so the percentage of people who are vaccinated who fall sick if they are infected is low, but if your infection numbers go up very, very high, in absolute terms, you can still be looking at quite a number of people falling very, very sick or die. And we want to preempt that. And this is especially relevant to elderly and to other higher risk groups. Israel, for example, has started booster program for all ages. UK, Germany, France will soon start for seniors. The US FDA has also approved a 3rd dose for immunocompromised individuals and is considering their recommendations for seniors. We announced at the last press conference that our expert committee, the EC19V, was reviewing our national strategies to boost vaccine immunity. And since then, the EC19V has observed data on the waning of immunity and the safety and efficacy of booster doses administered globally, and it has now provided its first set of recommendations on the need for booster doses for various subgroups of the population. It has recommended, and MOH has agreed, to administer a 3rd dose to the following 2 groups as the first step. First are immunocompromised individuals, and this should start from 2 months after their 2nd dose to ensure an adequate protective immune response. In the coming weeks, we will reach out to these individuals through their healthcare providers, as they would likely have regular follow-up with their doctors. So it's quite an involved exercise. We don't have a database of them and SMS them to invite them for 3rd dose, but we have to reach out to them one by one through their doctors. Second group are seniors aged 60 and above, and residents in aged care facilities. The EC19V has recommended that they should receive a 3rd mRNA dose 6 to 9 months after their 2nd dose. As some of them has received their 2nd dose in around March this year, so we will begin to invite individuals in this group within this month, the month of September. So all our uncle aunties out there, pachik machik out there, when you get your SMS invitation, please MOH recommend that you go to the vaccination center and get your 3rd dose and make yourself stronger and more resilient towards the virus. The EC19V will continue to review the evidence and data for other groups. One area the EC19V will pay specific attention to is the rare but more severe adverse reactions to vaccines, which occur mostly in the younger age group. Yeah. Another area will be the effectiveness of heterologous strategy. That means you use a different vaccine as booster from the vaccine used for your primary vaccination, the first 2 doses. Yeah. So a bit of mix and match strategy. Many parents have asked me about vaccination for children. I believe this will happen, but it may take some time because clinical trials are ongoing for those aged below 12 years to ensure that the vaccines are safe and effective for children. MOH expects vaccination for children to start early next year after the studies are completed and regulatory approval processes are carried out. Let me try to now say all that in Chinese. 感染力比较强的德尔塔变种病毒已经传播到全球各地。根据其他国家和我国自己的数据，我们很明显的观察到2点。首先，我们看到更多的所谓突破性感染，也就是德尔塔变种病毒突破了这个疫苗的防疫。所以我们看见那些完全接种的人还是被德尔塔病毒所感染。接种疫苗可以保护一个人不被感染，但是这方面的功力会随着每个月慢慢的减弱，因为身体的抗体就是 antibody， 所以逐渐的减少。本地的数据显示，疫苗保护力大概高达 40%。第二，疫苗对保护人们不会出现严重疾病甚至死亡，还是非常有效的。我们每天其实都有宣布相关的数据。过去的28天，完全接种的人被感染后，病情严重或病逝的有 1.3%， 而没有接种的人当中，这个病例高达至 9.2%， 所以7倍的减少。这是因为，就算体内的抗体减少的，但人的身体有一些记忆的细胞，可以让你在身体第2次遇到冠状病毒的时候，知道怎么样制造抗体来抵抗病毒。这就好像我们大家到学校学习一样我们为了应付考试，把很多资料挤进我们的脑袋里面。考试的时候通通出来，考试完后过了几个星期几个月，可能差不多都会忘光了。但是呢，我们还会保留很珍贵的教育、技能和知识，使我们一生人都能够受惠。所以呢，身体制造抗体就像预备考试一样，体内细胞的反应就好像教育一样。尽管我们承认抵抗力会减弱，也会越来越多接种的人会被感染，所以好些国家已经决定展开疫苗追加剂计划。这么做的目的是要避免这个突破性的感染突然增加，这就可以避免更多的人出现病情严重的情况。这尤其对我们的年长者和其他高风险的群体非常重要。以色列已经开始为每个年龄层施打追加剂，英国、德国、法国很快就会让年长者施打追加剂。美国的这个 FDA 最近刚刚批准那些被疫苗功能受损的人接种第3剂疫苗，他们也正在考虑为年长者施打追加剂。我们在上一次的记者会上宣布，冠病疫苗专家团正在探讨我国的接种策略。专家团已经仔细的研究其他地方的追加剂安全和效率的数据，现在已经完成了他们第1套的建议。根据专家团的建议呢，有2个群体应该施打追加剂。卫生部也同意 专家团的建议。那么是哪2个群体呢？首先就是免疫功能受损的人，他们应该在打完第2剂疫苗的2个月后去打追加剂，来确保他们有足够的这个免疫力。我们会在下来的几个星期，通过那些人的医生陆续的联络他们。第2个群体呢，是那些超过60岁的年长者，以及那些在养老设施的住户。专家团建议这群人在接种第2剂疫苗6个月到9个月以后施打追加剂。由于他们当中有些今年3月就打了第2剂疫苗，因此我们会从这个月起，就是9月起，陆续邀请他们追打追加剂。所以uncle auntie，当你们收到我们的邀请，通过手机 SMS 收到邀请的话，快点去打你的第3剂疫苗，这是卫生部所建议你所做的。专家团会继续的评估针对其他群体的证据和数据。专家团最关注的一点就是打了疫苗发生罕见而比较严重的副作用，而这个情况呢，通常发生在比较年轻人的身上。专家团关注的另一个课题就是这个混合疫苗的策略的有效程度。它的意思就是追加剂跟前2剂的疫苗不一样。很多家长也问我有关小孩子接种疫苗的进展。目前呢，针对未满12岁孩童的疫苗临床研究还在进行中。研究必须证明这些疫苗对小孩子来说是安全的，是有效的。卫生部估计这些研究完成后，而且得到相关监管单位的批准后，我们最快可能到明年年初才能够为小孩子施打疫苗。Now let me conclude. I want to end by saying we are now in a very different stage of our battle against COVID-19. In the past, we tried to suppress every cluster, trace down to the last infection, and try to eliminate them. But with the more transmissible Delta variant, this will be very challenging to do, and we may not be prepared to pay the price of doing so in the form of border closures, circuit breaker, heightened alert. It is just not sustainable. Therefore, with a high vaccination rate that we have now, we choose to live with COVID-19, transit to a COVID-resilient nation. Recognizing this, it is timely for MOH to revamp our daily reports again. The report must reflect the salient issues that we are facing in this new phase of the battle. For example, the vaccination rate is high and is plateauing. So there's very little need for us to present a detailed report with all the graphs every day. Perhaps when there's booster, we can start tracing, monitoring that, but there's no need to go into so much details now that we have achieved a very high vaccination rate. As we are not chasing down every single case, which means unlinked numbers are also not as relevant as before. Then on the other hand, our public wants to know more information about emerging clusters so that they can avoid certain places, so that they can regulate their own activities. And this is good, and we should make those information available in a timely way and in a relevant way so that the public can act upon it. That brings me to my last point, which is that at this stage, personal responsibility becomes very important. We all need to take care of ourselves and take care of the people around us. The government, on our part, we do whatever we can. Vaccinate as many of our population as possible, embark on booster program, continue to trace, test, isolate effectively, rigorously, offer good health care to every patient who is infected, put in place and enforce the SMMs, but we will refrain from one of our most effective measures. We will try our best to refrain, which is circuit breaker and heightened alert. I think most of us, all of us, don't want to turn back. For this refrain to be effective, then we must be able to fall back on alternate lines of defense. And that must be our personal responsibility and our community resilience. It means each of us observing SMMs, wearing our mask properly, covering mouth and nose, getting ourselves vaccinated, persuading our loved ones, our friends, also to get vaccinated. Don't spread misinformation. Go to a doctor when we don't feel well. Don't go to work, especially. Get ourselves tested very regularly. And employers too can play a big part. So this next phase of the journey depends critically on everyone's civic consciousness and social responsibility. So let's take care of ourselves and take care of people around us. Thank you.
Thank you, Ministers and DMS. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question only. If you are called upon, you will be prompted to unmute yourself. May we have the first question from Timothy of ST?
Thank you, Ministers. GMS. Now, Prof. Mark earlier explained in detail what could have caused the cases at bus interchanges. So we're wondering, what about Bugis Junction? What caused the spread there? And if the rise in cases was anticipated and we already hit our 80% milestone, then what target are we waiting for before easing measures? Thank you.
The question is the reason for the increase in the number of cases. Is that the main question?
Couldn't quite hear you. Can you just, what's the question again?
Sorry. At Bugis Junction, what caused the spread there?
Bugis Junction.
We're still investigating the clusters and examining how spread may have occurred. We think that this may have come from outside the mall, in other words, from the community. But then, as a result of spread within the workplace, then others were infected, involving the department store within the mall itself, and as well as other outlets. There have also been some common movement patterns within the mall for those who are infected. For example, eating, mass-off activities, using of common facilities, including the toilets, and there could have been some element of spread that occurred through the use of some of these common facilities as well. So this is a common situation that we've noticed happening in other clusters as well, where it starts off with an introduction from the community coming in, and at the workplace, if there was insufficient discipline in complying with safe management measures, then potentially spread can then occur within that particular workplace. And this is irrespective of whether it's a cluster occurring in a shopping mall or in other settings. And the Bugis Mall cluster is not different from that perspective.
Perhaps I should explain that this investigation is backward-looking. So meaning we have to investigate where the infection comes from. So it's extremely difficult to determine specifically how the virus is passed from one person to another. We just have to look at the setting and assess what is the most likely route that the virus has gone through. So I think as DMS is explaining that it's probably one of the customer or one of the employees that get infected, and then they spread among the employees in the mall or in the departmental store, and subsequently it may pass on to other customer, and then it became a bigger cluster in that way. But specifically, who passed to who is going to be very difficult to determine, because this is a backward-looking investigation.
I think the key point is that something like Bugis happened, mainly in one store. We went in, we closed the store, we contact trace, test everybody, quarantine, and today that cluster, after a week or so, pretty much has been suppressed. Now we are at the tail end. This is an important point, which means if we, based on our current posture of SMM and our current techniques of testing, tracing, and isolating, if we want to suppress a cluster, we can. The bus interchange is, as Minister Lawrence explained, is quite different because if we close down interchanges, the whole system gets paralyzed. So we are taking a longer period to trace, test, isolate without closing down, without disrupting essential services. So I think that is important, that we must always have the option to suppress if we want to.
Thank you, Ministers and DMS. Can we have the next question from Zhi Peng of Cao Bao?
Hi, good evening, Ministers and DMS. Have we procured sufficient doses of vaccine to be administered as booster shots? And may we know what is the breakthrough infection rates for the Sinovac vaccine? Is there sufficient protection provided by the Sinovac vaccine? Thank you.
With regard to Sinovac, the numbers that have been vaccinated are still relatively small, and we don't have enough experience to be able to say anything definitive about vaccine breakthroughs for Sinovac vaccination. It's still early. So we'll have to follow this through and to determine whether over time there are breakthrough cases that actually occur as a result of this group of individuals who had previously been vaccinated with Sinovac. The numbers are too small for us to make any definitive conclusions in this area.
Thank you, DMS. Can we have the next question from Si Hui of CNA?
Hi, good evening. My questions are about the booster shot strategy. When exactly will the shots be administered? And we also want to know why are frontline workers not the first tranche of people to receive booster shots, since they've been the first group of people to actually receive the shots. And then another question about...
Thank you, Si Hui.
I think I can take that. Si Hui, I think there are two parameters that the expert committee consider. One is who to give it to, and if we decide to give it to this group, at what interval. So when they decided who to give it to, they decided immunocompromised individuals. To them, that's very straightforward. And then secondly, after examining international data, seniors aged 60 and above and those that live in aged care facilities. They did not recommend booster shot for those younger. And having said that, second parameter, at what interval? And they recommended 6 to 9 months based on their expert advice. So when you put the two together, essentially we are looking at, in the month of September, we will start administering booster shots, third shots, to seniors who completed their second dose March and earlier. And in February there are hardly any, but March there are some. And so for those, we'll be inviting them to come for September. As for those who, say, healthcare workers who were the front line and they got their vaccination earlier, many of them are below 60 years old. But if there are some of them who are above 60 years old, they will be invited in September to take their booster shots.
Just to expand on the Minister's response and also to clarify a few issues, when it comes to offering the additional vaccinations after the initial primary vaccination, the expert committee recognized two different sets of scenarios actually occurring. The first was that there was a group of patients who may not have developed sufficient immune response in the normal two-dose vaccination regime that we had provided for them. And this is the group of immunocompromised patients who, even after the first primary regime, may not have mounted sufficient protection. So the EC19V recommends a third dose in order to ensure that they do develop this immune protection. This third dose is considered an expanded primary course of vaccination for them. Then there is the other group that did mount an adequate immune response, but over time, their immune protection wanes, and because of that waning immune protection, we have an interest in making sure that they are vaccinated to boost that immune protection. And the reason why we are prioritizing those above 60 is because we know that if they do get infected, they have a worse outcome compared to those that are younger. The increased risk of getting admitted to hospital, increased risk of needing oxygen supplementation, and increased risk of getting into ICU, and correspondingly even an increased risk of death. So we have an interest in making sure that we protect them even further to reduce this risk of having a bad outcome, so they are prioritized. And as Minister has mentioned, the migrant workers will, like every one of us, have over time a waning antibody response. But because they are generally in the younger population, we don't need to prioritize them as much as we do for those with the higher risk, in other words, those that are above 60. That said, if we do have migrant workers who are above 60, they do fall into that same group that we have interest in prioritizing them, and certainly they may also get vaccinated earlier. Otherwise, the rest of the population who are not within the above 60 group, we will offer them booster vaccinations at a later point in time, and that would be in accordance with the subsequent set of EC19 recommendations that will come out after they study the data further in terms of when is the best time to provide them with that booster vaccination and what form of booster vaccination is most appropriate for them.
Thank you, Minister and DMS. Can we have the next question from Abigail of CNBC?
Hi, Ministers and DMS. Thank you for taking my question. In Israel, they have announced that their vaccine Green Pass, which kind of functions like our fully vaccinated take one trace together, will expire 6 months after the second dose in a bid to encourage people to take booster doses. Do we foresee something like that happening in Singapore as well, where seniors who haven't taken their booster dose will be not considered fully vaccinated? Thank you.
No, they will still be considered fully vaccinated. As explained by DMS, I think we are taking a preemptive move. So far, when you look at ICU cases, death cases, it shows that our seniors are still very well protected against getting very ill should they be infected. So it's still working very well, but we are taking this preemptive step before antibodies wane further.
Thank you, Minister. Can we have the next question from Philip of Bloomberg?
Hi there. Can you hear me okay?
Speak slowly. Speak slowly. Speak slowly.
Okay, thank you very much. Okay, so the government has repeatedly said that Singapore would continue to reopen the economy and social activities once 80% of the population was fully vaccinated, a milestone that was achieved over the weekend. If the key metrics remain low, meaning serious illness and ICU cases, why is the government hesitating now, particularly when vaccination rates are peaking and most of the population has now the antibodies to sustain an infection? And if 80% is not the figure now, what is the new metric for reopening? Thank you.
Thank you. I thought I highlighted that in my remarks just now, but just to reiterate, we are taking some time to monitor the situation because there is a time lag between the onset of infections and severe illness or even death. So we've just seen a surge in cases, which we had said was not unexpected, but we want to take a bit of time to monitor the situation, to monitor the cases, to make sure that it does not lead to severe illnesses or to a rise in the number of people who need supplemental oxygen or ICU cases. In addition, we have just in recent weeks launched a few pilots where we're talking about vaccinated travel lanes with Germany and Brunei. We're talking about allowing our dorm workers to be out in the community more. So quite a number of things are happening now, and we want to allow these pilots to continue over the next few days and weeks. So the commitment to reopen continues, but as we have always said, we are doing it in a controlled manner, step by step, feeling the stones as we cross the river. And each time we make one move, we look at the situation, see the consequences of that move, make sure that our system remains intact, hospital system is okay, cases do not overwhelm our hospitals, and then we make the next move. So we've articulated that philosophy, that approach, and that's the reason why we are continuing with this move, but because of what I've just stated, we prefer to monitor the situation for some time before we take the next step, which will happen in due course.
Maybe I just add one point, which is if you strip away the terminology, whatever the name you call this phase, we have reached 80% vaccination rate, full vaccination rate. We are opening up in various ways, domestically and internationally. But in the meantime, we just didn't change the name to transition stage A. But other than that, I think we look at the substance. We are actually still progressing in the path that we have set up for ourselves.
Thank you, Ministers. Can we have the next question from Polling from Channel 8?
Hi, Ministers and DMS, Polling from Channel 8 News here. Previously, with the Jurong Fishery cluster, we actually closed down, as in tightened the measures immediately. But this time round, with the bus interchange cluster, which is a public mode of transport that Singaporeans use on a daily basis, why are we not doing, tightening measures this time round? What's the key consideration? Would appreciate if we can get a reply in Chinese as well. Thank you.
Well, I'll speak in English and perhaps we'll expand it accordingly. We continue with the same philosophy in terms of how we are managing the clusters as they rise. So in Jurong Fisheries Port, we tested quite aggressively, we contact traced quite aggressively, and we identified quite a number of individuals, putting them under quarantine, as well as various variations of isolation orders under HRW and so on. And when that extended into the markets, we did the same. But when we reviewed the results of what we're doing, while we were gratified to see that we were able to bring the clusters under control, it took considerable effort. We were putting quite a number of people under quarantine or isolation, but when it came to the actual numbers of those people placed under quarantine and isolation, ultimately those who ultimately tested positive were much fewer number. And we recognized that when we were doing this at a large community basis, there was a significant impact on the community, whether it's a social inconvenience, an inconvenience associated with going back to work. And we recognized that there was an opportunity for us to calibrate further our testing and isolation strategies to be a little bit more targeted, a little bit more focused, rather than in a very blunderbuss fashion, throwing a very large ring out, a very large net out, and putting a lot of people then under quarantine and isolation. So when it came then to the bus interchanges, we had some discussions with the sector lead, LTA, and we decided to adopt a much more focused and targeted strategy. We focused then on the interchanges as we saw cases emerging, forming clusters. We engaged in testing activities, initially with several test operations for us to understand better the scope and extent of spread that may have taken place, but then subsequently have evolved into working closely with the bus companies. And if the bus companies are themselves starting routine, regular testing of all their bus captains, it fulfills the need for us to have an extensive test surveillance without needing us to be continuing to invoke very extensive testing operations across all the interchanges as well. We also recognize that there was an opportunity for us to fine-tune and calibrate the number of quarantines that we issue, focusing really on the close contacts associated with each of the bus captains and in the area of activity where we thought spread could occur. It didn't need us then to shut down the entire interchange. And not needing to shut down the entire interchange has also given us the benefit of allowing essential services to continue. Public transport still continuing, and therefore less inconvenience to the public, recognizing that the activities they do when they travel through the interchange, getting onto the buses and then moving on in their own journeys, they are not at an increased risk compared to the bus captains in those rest areas. So it's an attempt to find the right balance that has led us to where we are today with the bus interchanges, which is slightly different setting from when we were managing the Jurong Fisheries Port and the market cluster.
Kenneth 讲的一番话我没有办法翻译，我就大概解释一下，主要是巴士车站不同购物中心也不同巴刹这些地方如果有感染群的话，我们可以把它封锁起来，但是巴士总站呢，到处被封锁，就没有巴士打了嘛，所以我们的公共交通是机要服务，公众的机要服务，所以我们做的方法就不一样。所以，但是呢，我们还是非常积极的去追踪、检测还有隔离，所以这前几天就在巴士总站进行了这样的一些措施，而且是有效的。刚才我用英文也有解释过了，好像文理总站呢，4天前就是8月30号，一共有21起病例嘛，今天减少到5起了。大巴窑呢，4天前20起病例，今天3起。但宾尼呢，5天前8起病例，今天呢是1起病例。所以用我们现在的这样比较针对性的做法也是有效的。所以在巴士总站的病例已经慢慢减少下来。我们今天看到的比较高的病例，原因是因为无关联的这个病例比较高，而且一些病例还没有被classify 了，还没有被组合所以增加的元素不是因为巴士总站的原因，而是其他的原因。
Okay. There is one consideration that is different when you look at the Jurong Fishery Port and the bus interchange cluster, which is vaccination rates. At the time when we had the Jurong Fishery Port, yes, our vaccination rate was good, but we were concerned, especially for our unvaccinated seniors. And the markets and hawker centers were places where many of these seniors are. And when transmission happens there, we were very concerned that unvaccinated seniors may get infected and will fall severely ill. And that's why it was a very difficult decision to make, as we had explained. Even then, we thought that maybe we need not have gone into a heightened alert. We thought we would have been able to put heightened alerts behind us at that time. But because of this concern for unvaccinated seniors, we decided we had to put in place that measure. But since then, our vaccination rates have continued to go up. We have covered many, many more seniors, and therefore we have greater assurance that they are protected. That's also one key consideration that explains the difference in our responses then and now.
谢谢，这个值得翻译。我讲几句话。第一就是不同点，那时候玉朗渔场的病例呢的病群呢，跟现在巴士总站的不同点，有两个不同点。第一就是那时候玉朗发生的时候，我们的这个接种比例才42%，如果记得的话，现在已经是80%。第二就是那时候卖鱼的这些商人呢，去到了这个渔场，然后回去他们的巴刹卖鱼，所以就接触了很多年长者，因为很多年长者都去买鱼，都去巴刹，所以这些年长者很多还没有接种疫苗，所以他们的风险非常高。而现在呢，巴士总站呢，巴士车长就比较年轻，而且都是已经接种疫苗，所以不同点就在这里，我们的反应也不一样，就是因为这个原因。
Just to add on, this is also indirectly responding to the question from Philip, that with the increase in the vaccination rate, actually we have made a continuous shift in our approach to this COVID-19 infection. This is particularly in our approach to public health measures. So instead of a major lockdown, like a phase 2 heightened alert, we have now are able to do a more targeted approach, and primarily also because of our much higher level of vaccination, especially among the seniors. And I think Minister Ong has mentioned earlier, or even the last conference, to talk about how we treat infected patients, and we are now able to also allow them to recover from home and many other measures that have shifted. And now we are also shifting towards more self-testing, and this will allow us to continue to move towards COVID-19, a resilient nation. So I think we are continuously shifting our public health approach based on vaccination rate, based on the infection landscape, and based on our healthcare capacity.
Thank you, Ministers and DMS. We will now take the last two questions. Can we have the next question from Tessa of Today?
Good evening, Ministers and DMS. So my question is actually on the rising number of unlinked infections as of late. Could I just find out, is the rising number of unlinked cases a concern, and what's driving this increase, especially with Trace Together being mandatory and its use so widespread? Why are the number of unlinked cases still elevated? Are there multiple strains causing this spread, or is it just a single strain? Thank you.
Thank you very much for that question. As Mr. Ong had mentioned, we're less focused increasingly on this issue of linked and unlinked. When numbers of cases come up, it becomes more and more difficult to establish epidemiological links within a very short space of time, in time for reporting cycle, that comes on a daily basis. So you will see inevitably as numbers come up, an increasing number of cases which we provisionally tag as unlinked, but subsequently over the next few days, we do establish links that go on, and further opportunities for linking cases to clusters arise as we complete phylogenetic testing and those results come up. And we have been fairly successful in a number of cases establishing those links after that. But you don't see that in the initial report because the numbers do reflect increased number at the first time these reports come out. So just because we have larger numbers of unlinked cases, it's not necessarily a cause for worry. It's also partly a function of time that we need, an effort that needs to be taken in order to establish some of these links when the number of cases in the community start to come up as well. It is more important, given the higher vaccination coverage rates we have now, to focus really more on the public health actions moving forward, rather than necessarily looking backwards for those links. In all the cases so far, we've found that they are predominantly the Delta strain. And when we talk about in terms of the unlinked cases that we have so far been able to carry out phylogenetic testing, they are also similarly predominantly the Delta strain, but some subvariants that suggest then perhaps more linkages with certain clusters compared to others, and that's been an opportunity for us to link things together. But we've not been seeing new introductions of other variants so far. At one stage, people were concerned about what was the so-called Delta Plus variant. We've not seen that. More recently, people have been talking about the Mu variant. We've not seen that either. But we continue to keep a close watch. The increased number of unlinked cases are not due to new viral variants emerging in Singapore.
Can I add something? Maybe just take a couple of steps back. When we see an unlinked case, whatever we do is to control the pandemic and control the spread. Yeah. So in the past, when you see unlinked cases, you want to link them. What for, right? It's because I will link, I trace, and then I link back, oh, this restaurant or this household, it belongs to this cluster. So I'm not worried. So long as we isolate the person plus their contacts, we know that this unlinked case is settled, is now linked. But if we link it to somewhere that we are not aware of, that this person went to this particular market and from there he somehow had gotten infection and is unlinked, then we know the source in that market has to be addressed. And so we go in, test everybody, isolate those who are positive, quarantine, and then we also eliminate the source. So the whole idea of linking is to eliminate the source, go backwards and eliminate the source. And so linking is important when you want to eradicate the virus. But once we are prepared to say that we can live with it, we vaccinate ourselves so that we don't fall very sick, treat it like influenza, then I think the need to link everything becomes less important. Yeah. Our strategy now must change. As I mentioned just now, the stage of a battle has moved on. So where we focus on in terms of controlling and the pandemic must also shift, which is also why our daily reports must also reflect our new strategy.
Thank you, Minister and DMS. We will take the last question from Eileen from Wanpao.
Hi, good evening, ministers. So I would like to ask whether do we have enough vaccinations to do the booster shots, since we have, this exchange program with Australia and we've given them some.
Answer is yes. We have done all our calculations before we do the swap. In fact, the swap is advantageous to both parties and is win-win because Australia is ramping up their current primary series, so they needed more vaccines, whereas we will start booster, but in September the numbers are few, right? Because senior 60 and above who have taken their second shots in February or March, there are not that many. But as the months go by, the number will increase, and we might also extend to younger population after the EC19V has done their studies thoroughly, which means towards the end of the year and beginning of next year is when we need more vaccines. Then Australia will be returning us. So this is a win-win arrangement, and I'm very glad that Australia and Singapore can get into a partnership like that and fighting COVID-19 together.